Now, as you can see from the little work I just did, you can see TKA, you can see redness, you see blood, a little bit of TKA, but you can see basically the blood coming to the surface because we got some blood movement there. I use essential oils. I'm putting oil on my hand, the chest, and it's not a whole lot of oil, and I'm just going to, now I didn't do the shoulder and the neck, and I always ask my client to take a deep breath, and then they breathe in essential oil, and then when they exhale, I get the oil on, and we have effleurage. So now we got some oil here. You don't need a whole lot. Now I put that oil there because the first tool I'm going to use, and I do use tools and I think you should too, is rapid release. Now when I cut this on, you press the button, you see it cut on, you can see the RPMs going. And what I'm going to do for purposes of the video, wipe some oil off my hand off the tool so that we can see this a little bit better now that oil is there. There's a button on the bottom. I'm just going to cut that on, and this one has 3 different levels, right? So you can see this allows you to get deep, broad, or kind of in the middle, but this is a little bit more intense. So what I'm going to do is use the broad and let the client let you know the intensity. So here we go, and I'm starting at attachments and I'm going out. And so as I ask questions, I'll watch your hand, just give me a thumbs up or down for yes or no, so you don't have to. Okay, so it's sternal attachments, and I'm going out. You don't have to press a lot with these. And what this is doing, as you know, vibrations break up fascia. Now, as you can get deep, you can go in here and go under there and pull and do all that. And purposes of the video, do this. So I can hit the sternal attachments, going on clavicular, and coming over here. I like this tool because you can hold it. It's great for trigger points without doing a whole lot of digging, but I like it because it breaks up fascia. All right, so we're just breaking up some fascia with RPMs, making it easy to go in. Another reason I like this, I can put this directly on bone. So how does it feel?
Good.
So I can put this on bone. So this gives me like some of those tiny attachments, those ligaments, I don't have to worry about, because when I put this on bone and hold it, it's not going to be painful like the massage gun or the percussion gun that can bounce off. So I'm using this to just loosen up muscles. If you need to go deeper, hit attachments. I can go up, feel a little different, and I can do attachments. So there you go. All right, so the next tool that I'm going to use is going to be the scraping tool. So the scraping tool, what we're going to do, same thing. I'm just going to do a little bit of this. I can stand up and do this, because some of this stuff you can do as well. And what I'm going to do, hand over hand, and you can press and you can push out. You can press, you can push out. You can press, push up, press, and push up. All right? And I'm going to go in here with the scraper or instrument assisted soft tissue mobilization tools. Not a whole lot of pressure. I'm just going to press. And this is one with a little bit of oil. Don't have to have a whole lot. I like this one, because I can get in here, and you can get in here and just, you can really just, it's meant to scrape, right? I always focus on origins and insertions, and then try to go the direction of the fibers of the muscle. So I can get in here, and you can really just get in here, right? So I know I can just dig in here, and there's a bodybuilder, or, there's tissue here, but I can dig in here, and you have to determine the level of depth and pressure you're going to use based on the tissue. You see that blood flow, right? And so you see that blood flow. This also is a TENS instrument, so I could have cut this on and it would have gave me some TENS, but you don't use that too much on the chest. And the other tool I'm going to use is this contrast percussion gun. Now here's the thing about this. The contrast percussion gun, this one is hot and cold. So right now I have it on heat. And I'm going to cut it on. It goes up to 6. I'm going to put this on 2. Because it doesn't need to be super high. And you talk to the client, but for purposes of this demonstration, I'm going to put it on 2. And it's the same thing. So people say, what is this doing? And you can see that. And this is doing the percussion with heat. So all of this is helping give you some good blood flow, and you stay off of bones. And people may say, oh, going the wrong direction. Well, you always got crossfire, so you can, depends on the way you want to do what you do. And I like this because I can take it with the heat, put it at these joints, hold it, and let the heat do the work. And you can use these contrast percussion guns. You don't have to have hot stones, right? And make sure you get these attachments. And when I use this, you put it close to the attachment as you can possibly get it. And I like holding it here at the shoulder attachment here because it's one of the biggest attachments. And another thing is you could, you get the shoulders, you can get everything with this. And this is on 2. Don't want it too hot. I put the heat all the way up. And this is heated up. Now I use 3 tools here on the chest. And you can see the blood flow. You can see the blood coming up. And you can see it's warmed up. Blood is showing. Blood is flowing. Good circulation. We did some stretching. Use 3 tools to go in there and break up tissue, break up fascia, hopefully break up or activate some ground substance. And here we go.